Bismillahirrahmanirrahim. Quote of the day: set your life on fire, seek those who fan your flames. Today, the topic of my presentation is Introduction to Health Economics, Types of Economics, Economic Appraisal, and Opportunity Cost. Learning outline of my presentation are health economics, types, economic appraisal, and opportunity cost. Learning outcomes. By the end of this presentation, participants would be able to understand about health economics with its types, economic appraisal, and opportunity cost. Now, what is economics? It is the science of production, distribution, and consumption of goods and services. It includes all about the inputs such as resources like equipments, personnel, building, that leads to the production process, and then this leads to the outputs, which includes goods and services and the mediating factors for the production process. So all of these are included in economics. Now, health economics. It is defined as a branch of economics that is concerned with how resources are allocated and used in different health systems. It is the logic framework that helps healthcare personnel, healthcare decision makers, and governments to make choices on how to make the best use of limited healthcare resources. It is a branch of economics concerned with issues related to efficiency, effectiveness, value, behavior in the production and consumption of health and healthcare. It is important in determining how to improve health outcomes and lifestyle patterns through interactions between individuals, healthcare providers, and clinical settings. In broad terms, it is the study that leads to the function of healthcare systems and health affecting behaviors such as smoking, diabetes, and obesity. So the applications of theories, concepts, and techniques of economics to health sectors, they all come in health economics. And it includes allocation of health resources, quantity of resources used in health delivery, organizing and funding of health institutions, effects of preventive, curative, and rehabilitative health services on individuals and society. This is the framework of health economics. So health economic consists of 8 components. First is that what influences health. Then comes what is health and what is its value. Third is demand for healthcare. Fourth is supply of healthcare. Then comes microeconomic evaluation. Then comes market equilibrium. Then comes evaluation at whole system level. And the 8th component is planning, budgeting, monitoring mechanisms. Now, types of economics. It can be divided as microeconomics and macroeconomics. Now, what is microeconomics? It includes individuals, households, community decision on demand and supply. Macroeconomics is at state or country level. So state or country analyzes economy as a whole rather than focusing the price in individual market. Microeconomics focuses on supply and demand and other factors which determine the price seen in economy, while macroeconomics focuses on inflation, economic growth, and international trade. Microeconomics is bottom-up approach, while macroeconomics is top-down approach. Economics can also be divided as positive economics or normative economics. Positive economics examines relationship of different economic variables and provides analysis of these. It includes description, quantification, and explanation of economics phenomena. Like the example for this is that government spending on health is 2.8%, which is affected by many factors. While normative economics, it focuses on value judgment about what should happen. For example, government spending on health should be increased. So the focus on value judgment is comes under normative economics. Contribution of health economics in health planning. It improves allocation of health resources. It increases efficiency, identifies cost-effective technologies, and evaluates alternative sources of health finance. Basic concepts in health economics. First comes scarcity and choice. The resources for satisfying human wants are limited. Collectively, we want more than we can produce with our limited resources. So, economists help to determine the use of scarce resources to satisfy the most important wants. Because resources are desirable and scarce, we must make choices for the use of these resources, and economics is the study of choice. Then comes production possibility frontier. This is a curve which shows various combinations of the amounts of two goods which can be produced within the given resources and technology. It is a graphical representation showing all the possible options of output for two products that can be produced using all factors of production where the given resources are fully and efficiently utilized per unit time. This is a graphical representation that is showing positive uh, 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 possibility frontier. In this, we can see that this is the combination of two products, wheat and cotton. So, in order for the economy to produce more wheat, it must give some of the resources it is currently using to produce cotton, as point A is showing. And if the economy starts producing more cotton, it would need to divert resources from producing more wheat, and consequently, it will produce less wheat than it is producing at point A. So, in this graph, we can see that if we want to increase the output of cotton, so it should deliver some of the resources which are being consumed by the wheat, as shown in the figure at point B. In macroeconomics, the PPF is the set of points at which a country's economy is most efficiently allocating its resources to produce as many goods as possible. Then comes law of diminishing returns. The law of diminishing returns is a theory in economics that predicts that after some optimal level of capacity is reached, adding an additional factor of production will actually result in smaller increase in output. For example, there is a factory in which employee workers are manufacturing its products, and at some point, the company operates at an optimal level. With all other production factors constant, adding additional workers beyond this optimal level will result in less efficient operations. As we can see in this graph, that this is the area where there is most production taking place. Here, input leads to productive returns. It pays to invest more time effort. But then comes a point of diminishing returns, after which there is a area which is called diminishing return, that in this area each added inputs leads to a decreasing rate of output. So it's best to stop somewhere within this phase, as we have already discussed in previous example. Opportunity cost. Opportunity cost represent the potential benefits an individual, investor, or business misses out when choosing one alternative over another. For example, these are the two examples to clear this concept. First is that someone gives up going to see a movie to study for a test in order to get a good grade. So the opportunity cost is the cost of the movie and the enjoyment of seeing it. Then comes the second example in which a player attends baseball training to be a better player instead of taking a vacation. So here the opportunity cost was the vacation. We would discuss the opportunity cost in detail later. Then comes another concept of supply and demand. The relationship between the quantity of a commodity that producers wish to sell at various prices and the quantity that consumers wish to buy, that is supply and demand. It is the main model of price determination used in economic theory. The price of a commodity is determined by the interaction of supply and demand in a market. Then comes elasticity. The change in prices is called elasticity, and the determinants of it are the extent to which substitutes are available. For example, if substance is being produced more and it is coming in the market in very excessive amount, then its price starts decreasing. So this is one of the determinant, that the extent to which the substitutes are available. Then comes proportion of consumer income spent on good, and third is time frame. Discounting. The time value of money indicates that there is difference between the future value of a payment and the present value of the same payment. So this difference is the discounting. Discounting is a means of assessing how much less an amount is worth in the future than it is now. This is the formula through which we can identify the discount factor. For example, if an ongoing investment in healthcare, such as reduction in cardiovascular risk using low-dose aspirin therapy with expenditure of $100 per annum over 5 years, and costs were discounted at 6% in years 1 to 5, the net present value cost would be $1,276. Income sensitivity analysis. It is the technique for investigating impact of project variables on the outcome, and includes key variables which influence project cost and outcomes. The identification of key variables will investigate consequences of likely changes of these key variables, and to identify actions which could mitigate key variable effects on projects. Moving on to other topic of my presentation, economic appraisal. Economic appraisal comprises a set of techniques that weigh up the cost of an action, such as providing a public health intervention to an at-risk population group against the benefits that it provides. Objective. The aim of economic appraisal is to ensure that the benefits from healthcare programs implemented are greater than the opportunity cost of such programs by addressing questions of allocative efficiency or technical efficiency. Now, what is allocative efficiency? It assesses competing programs and judges the extent to which they meet objectives, and technical efficiency assesses the best way of achieving a given objective. Economic appraisal uses one of the following methodologies. These are the four methodologies that are used by economic appraisal. That is cost benefit analysis, cost utility analysis, cost effective analysis, and cost minimization analysis. These methodologies are distinct from each other and are used to assess different efficiency questions. The distinction between the methodologies is found in the way in which the consequences are measured and valued. First is cost benefit analysis. In this type of analysis, all outputs are measured in monetary terms. Cost utility analysis. This is a measure to determine allocation of resources. Cost effective analysis. In this, a clinical output such as morbidity, mortality, reduction in BP, or quality of life, etc., is measured as a measure of the effectiveness. Cost minimization analysis. In this, the inputs are compared and outputs are considered to be equal, which rarely so. Now, these are the tools, and we would study that in which application they are being used, and these are the examples given. Cost minimization appraisal or analysis. In this, the outcome is given. The object of appraisal is to deliver it at least cost. For example, putting a service specification out to tender and choosing the lowest bid. Then comes cost effectiveness appraisal. It is choosing between two or more alternatives with different costs and outcomes, and where the outcome is measured in a natural unit like BP, tumor size, or independence. It is limited to comparing like for like interventions with the same units of outcome. So example is like choosing between two or more medicines to treat blood pressure or cancer, or choosing between two or more care packages or any interventions for frail older people to preserve independence. Then comes cost utility appraisal. Similar to cost effectiveness, except all outcomes are converted to the same utility units, typically quality adjusted life years. It has the advantage of supporting choices between options with different natural units, for example, hip replacement, cancer treatments, or heart operations, which can be converted to quality adjusted life years. Example is allocative efficiency decisions for planners, such as how to divide up a large budget between several competing programs and care groups. A cost per quality adjusted life year legal tape would be a good place to start. Then comes cost benefit appraisal or analysis. In this, both resources and outcomes are ascribed monetary value. The difficulty arising in ascribing monetary values to outcomes such as years of life, pain, morbidity, or antisocial behavior. And government departments use this technique, and their tables and norms as for different values are given in this link. So it answers questions such as, should we invest at all? Will there be a payback in a reasonable time frame? Or who pays and who benefits? What is the social return on investment? So all the like resources and outcomes all are ascribed in monetary value in this analysis. So choose of a type of economic analysis. These are the different scenarios in which different analyses are being chosen, like cost minimization analysis is chosen when the compared technologies are equally effective. Then it is only necessary to collect data about cost. And then comes cost effectiveness analysis. When the effectiveness of the compared technologies are different, that is different in cost, have to be weighed against the difference in effectiveness. When a technology dominates the other technologies, that is more effective and cheaper than the compared technology. Third is when activities with the same aim and measure effectiveness are compared. Then comes cost utility analysis. It is chosen when health related quality of life is an important health outcome, when activities across specialties or departments in the healthcare sector have to be compared. Then comes cost benefit analysis. It is used when non-health effects are also important. For example, the treatment process itself, utility of information, when only one technology is assessed, when there is a wish that individual lives are valued in monetary units, when activities across society have to be compared. Now, how is economic evaluation or analysis relevant for public health? Allocating resources and implementing public health interventions, whether policies or programs, requires an understanding of the relationship between the resources used, like labor and capital, and how health outcomes achieved, like cases prevented, life years saved, and disability averted, that are achieved by the program or intervention. So economic evaluation consider both simultaneously, like resources use and changes in health outcomes. What is economic evaluation? It is the systematic assessment of one or more policies or programs in terms of cost and outcomes. For example, consider the childhood vaccination schedule recommended by the Advisory Committee on Immunization Practices in 2009. And economic evaluation found that following this recommendation would like input was the cost worth $7.5 billion, and the outcome was that the prevention of 20 million cases of diseases and 76.4 billion rupees in medical costs and productive losses and 42,000 premature deaths. So this was the health outcome, and this was the input. So all of this were being assessed by the economic evaluation. Now, cost effective analysis. It is a way to examine both cost and health outcomes of one or more intervention. It compares the net cost to changes in health outcomes resulting from an intervention. And outcomes are expressed in health units, for example, cases of diabetes prevented or years of life saved. And it allows us to compare different interventions that have the same health outcomes. So cost-effective analysis compares the net cost of an intervention to the changes in health outcomes. And how we define net cost and changes in health outcomes. Net cost is achieved by subtracting cost averted from cost of intervention. And changes in health outcomes, we can get it by subtracting outcomes without intervention from outcomes with intervention. We can see in this example that cost of implementation for that project was $7.5 billion. And the cost averted from medical costs and productivity loss was 76.4 billion. So the cost which could be saved was the net cost, which was 68.9 billion. and changes in health outcome are 20 million cases of diseases prevented through routine vaccination compared to no vaccination scenario. Now moving on to our last topic of presentation, opportunity cost. Opportunity cost refers to the loss of potential benefits from other options when one option is chosen. To estimate the health gains that could have been achieved elsewhere with the same levels of investment, the opportunity cost of investing in a healthcare intervention is best measured by the health benefits like years saved, quality adjusted life years gained, that could have been achieved had the money been spent on the next best alternative intervention or healthcare program. Health opportunity cost can be assessed directly with cost effectiveness or cost utility studies. Now, cost effectiveness ratio, that is the money or outcome of different interventions, enable opportunity cost of each intervention to be compared. When two or more interventions are compared, cost utility effectiveness analysis makes the opportunity cost of the alternative uses of resources explicit. Recent updates. This is the article titled as Cost Effectiveness of Telerehabilitation versus Traditional Care After Total Hip Replacement, a trial-based economic evaluation. According to it, the primary analysis used an incremental cost effectiveness ratio to compare the cost per quality adjusted life years accrued in the telerehabilitation group versus in person control using cost and effects data from the randomized trial. Estimated mean differences in healthcare cost and quality adjusted life year gained were not significant. However, telerehabilitation significantly reduced the time burden for patients and carers. Economic evaluation and analysis. The economic evaluation and analysis team assists countries to collect, evaluate, and introduce economic evidence into health policy, cognizant from the start of resource constraints in countries at whatever income level. Prioritization with the focus on allocative and technical efficiency is a key work area addressing the resource allocation decisions that policymakers regularly face. The work area on value for money and prioritization also includes consideration of health system feasibility, cost and budget impact, and an assessment of the contribution of improved health to the economy. Economic evaluation and analysis also measures and evaluates the impact of health financing and other policies on universal health coverage, especially on equity and financial protection. This is another article titled as Health Economic Analysis of Post-Operative Video Telemedicine Visits to Patient Homes. The importance of this study is that a post-operative video telemedicine follow-up program was introduced by the Mayo Clinic. An attempt was made to understand the potential cost savings to patients before contemplating full-scale expansion across all potentially eligible surgical patients and practices. The objective of this study was that the primary purpose was to estimate potential cost savings to patients with video telemedicine follow-up to home compared with face-to-face follow-up in a standard clinic setting. Results. Patients who utilize video telemedicine rather than face-to-face clinic visit for post-operative follow-up were estimated to save eight triple eight dollars per visit on average. More specifically, patients residing more than 1,635 miles round trip from clinic saved an estimated 1,500 per visit, and patients not needing accommodation still saved an estimated $256 per visit. Patient satisfaction over video telemedicine post-operative follow-up visits remained high over the 6-year period of study. Now moving on to MCQ session. MCQ number 1. In an editorial, the author has suggested to increase grassroots workers for achieving universal healthcare in Pakistan. This is an example of pragmatic economics, negative economics. Any idea about the right guess?
C.
Yes, C is the right option, normative economics, because in this scenario, a judgmental view is being given by the author that by increasing grassroots workers, it would lead to the achievement of universal healthcare. MCQ number 2, a country has allocated 3% GDP on healthcare spending and then assess the major healthcare outcomes including maternal mortality rate, infant mortality rate, and neonatal mortality rate. This is an example of microeconomics, macroeconomics, normative economics, negative economics.
B.
Yes, right option is B, macroeconomics, because in this scenario, country level economics is being discussed. MCQ number 3. An economist described, analyzed, and quantified different variables responsible for high neonatal mortality in Pakistan and cost of different interventions to lower it. This is an example of mixed economics, positive economics, normative, negative economics.
B.
Yes, B is the right option. MCQ number 4. An operation theatre has capacity of 4 patients at a time in a hospital near Lahore. A senior gynecologist has started laparoscopic hysterectomy in that hospital, as a result of which the number of daily laparoscopic hysterectomies has increased. However, the number of cesarean sections in that hospital has decreased. This is an example of opportunity cost, production possibility, frontier, scarcity, shift.
A.
Yes, A is the right option. MCQ number 5, the economic evaluation method that puts a monetary value on both the cost and the output is cost analysis, cost minimization, cost benefit analysis, cost utilization analysis.
C.
Yes, C is the right option. MCQ number 6, a factory employee works to manufacture its products, and at some point the company operates at an optimal level. The factory hired more workers beyond this optimal level, keeping all other production factors constant. This addition would result in less efficient operations. Which of the following concept is highlighted? Production possibility, frontier, discounting, compounding, law of diminishing returns.
D.
Yes, law of diminishing returns is the right option. MCQ number 7. There are 3 basic types of economic evaluation methodology: cost effectiveness analysis, cost benefit analysis. What is the missing type? Any guess about the right option? Insurance benefit analysis, technical efficiency analysis, clinical efficiency analysis, allocative efficiency analysis. D is the right option, allocative efficiency analysis. MCQ number 8. Which of the following questions is addressed by microeconomics? What percentage of his income should a person save? Which country in Latin America has the worst economy? What is the average cost of a house in a community? How will the location of a new drugstore affect its success?
B.
Yes, B. This is a very easy MCQ. MCQ number 9. A media person wants to know effect of language barriers and land barriers on polio vaccination drive so that the effects of them on the vaccination drive can be minimized. This is an example of discounting, compounding, sensitivity analysis, specificity analysis.
C.
Yes, right option is C. MCQ number 10. A policymaker wants to improve health and education in a community. The point at which both services have been allocated their resources and are functioning in the best way is called opportunity cost, production possibility frontier, scarcity, demand.
B.
Yes, right option is B. This is key of MCQs. Thank you.